Lady, Leslie, are our presenters ready? Our presenters ready? Bless you. Good afternoon, everyone. We will call to order the Indianapolis Community Affairs Committee. Today is Wednesday, July 27. It is 5:30 p.m. I will have my colleagues introduce themselves, starting at the bottom left.
Thank you, Madam Chair. My name is Michael Paul Hart, representing District 18.
Thank you, Madam Chair. Josh Bain, representing District 20 on the southwest side.
Thank you, Madam Chair. Kristen Jones, representing District 16.
Thank you, Madam Chair. Ethan Evans, representing District 4 on the northeast side.
Thanks, Madam Chair. Good evening, everyone. Keith Graves, District 13, east side of Indianapolis. Thank you.
Thank you, Madam Chair. Good evening, everyone. Zach Adamson, District 17, the near north, near east, and near southeast side of downtown.
And I'm your chairwoman, Councilor Keisha Jackson, District 14, representing Lawrence Townships on the far east side. First order of business, proposal number 245 to reappoint Councilor John Barth to the Public Art for Neighborhood Selection Committee. Councilor Barth is not here present today. His information was sent out. Do we have any comments or questions for from the council? Any from the public?
Madam Chair.
Councilor Adamson.
Thank you, Madam Chair. I'd move that we send proposal 245 to the full council with a due pass recommendation.
Second.
All in favor?
Aye.
Any opposed? Ayes have it. Thank you. We have a counselor that joined us. When you're ready, go ahead and introduce yourself, please.
Good evening. Thank you, Madam Chair. Paul Arnay, District 23.
Thank you, Counselor. Next on the agenda is Indiana's Comprehensive Crisis Response Strategy Update. We have Jay Schotterhary, Director of Division of Mental Health and Addiction. Thank you.
All right, thank you. Thanks for inviting me. I'm happy to be here today. It's a lot quieter on this side of Market Street today than it is over there. So, my name is Jay Chaudhary. I'm the Director of the Indiana Division of Mental Health and Addiction. I'm here to talk about our comprehensive crisis response system that we're building, and building it off of what you've probably heard of now as the new three-digit number for crisis response, or 988. But before I start, I want to say a couple things about 911 because I think they're kind of instructive as we look at what we were hoping to build off of 988. So the first thing with 911. When you think about 911, you don't just think about the number in the call center, right? You think about the ambulance and the EMS and the level 1, 2, 3 trauma centers and the emergency room and all the other different things that people intuitively think about and know they'll be able to access when they call 911. And that's very similar to, I think, our vision for what we hope to build on using 988. And then the other thing about 911 is it was built over the period of about 50 years. So, when we think about time horizons, this is not going to happen tomorrow. This is not going to happen next month or even by next year, but we hope to build consistently and rapidly towards it over the next several years. So, next slide. So this is the state of crisis response today. Not only in Indiana, but really for most of the country. You have a variety of different hotlines and call lines, including 911, that folks call. Nobody really knows who to call, when to call. It's there. You get a patchwork of responses, and those responses are not necessarily tied into any of the larger infrastructure. But those responses generally include law enforcement. And they generally end up in one of two places, right? The emergency room or jail. And what we hope to do is build a dedicated crisis system that will reduce the strain on that emergency room and jail and really get people into a better place to go. And so that's what it looks like right now, and the next slide shows you our vision for the future. We're building this crisis system, again, over the next several years, on basically three pillars. Someone to contact, so that someone to respond, and a safe place for help, along with a robust state infrastructure connecting all three of them. Our goal is quite simply a system capable of serving anyone, anytime, anywhere, and anyone means anyone. Equity is very important to us in this work, in all its different stripes. Anytime, obviously, 24/7, and anywhere, from Indianapolis to Jasper to LaPorte, and we hope to have the same type of system everywhere. So I'll go into these three elements really quickly and then open up for any questions. So the someone to contact element of it has been our main focus right now, because we were mandated by the federal government to be able to answer calls to 988 on July 16th of 2022. And we're pleased to report that we do have that capacity right now. So we currently have 3 National Suicide Prevention Lifeline centers. We're bringing 2 more online, and our goal is by Q1 of calendar year 2023 to have all 5 of those centers online on the same platform, sharing data, and able to essentially all of them able to provide statewide coverage. We'll see if we meet that. We're on track right now, but the someone to contact is just the first part. So, next slide. Someone to respond. Generally, these are called mobile crisis teams. You have one here with the Mobile Crisis Assistance. I believe that's what MCAT, was that what it stands for? I don't remember, but MCAT is similar here. Our main principles around mobile crisis are the importance of peers. So we know, and the data shows, that somebody with lived experience in a crisis or with mental health challenges is the best tool to build rapport in the scene of a crisis. And so we are going all in on the role of peers in crisis. And then the other one is flexibility. We know that different communities will look different. Some communities only have EMS, so the crisis team will be a peer in EMS. Some communities have the ability to have a clinician on the team, so the team will be a clinician and a peer. There's an open debate about whether or not law enforcement should be part of this team. I think we all know the different contours of that debate, and we're not here to take a position on it today. I think that this will develop over the next several years. But the goal is for these mobile crisis teams to be plugged directly into those 988 centers, so there can be a direct dispatch. We're interfacing very closely with 911 and all the different 911 centers, and so we'll have bi-directional communication ability with 911. So if a situation appears to be more appropriate for that type of response, we'll be able to kind of flip that switch and make that happen. But this will be a learning process. We're not going to sit here and say that it's going to be perfect from day one, but we're very excited about this development as well. And then next slide. The last piece, obviously, is a safe place for help. So we are supporting the construction and launching of what are called crisis stabilization centers in various places around the state. These are places where individuals can be brought by law enforcement or EMS or a mobile crisis team or whoever ends up responding, geared towards stabilizing somebody in crisis and getting them to the right place. These are therapeutic environments, not carceral. That's very important. And they really, the best case scenario, they operate under what's called a no wrong door philosophy, which means that, they'll take anybody regardless of where they come from, and then they'll get them where they need to go based on what their needs are. The best sort of example of this in the entire country is in Tucson, Arizona. So we recently sent a team out there to learn from what's called the Tucson model, and we hope to bring some of those learnings here. If I offer my opinion, I think Indianapolis is pretty well poised to adopt something like that, and we'd be happy to have further conversations about how the state can help make that happen, because we know it's really important. And the Tucson model and then a couple other models around the state have really shown some pretty amazing data and outcomes from their implementation, which you can kind of see on the next slide. This is one example of those. So there's a couple states that are way ahead of us now. Tennessee started building their crisis continuum in 1991, so they're way ahead of us, obviously. But they shared this data with us, and as you can see, less than 1% of the people that ended up calling the crisis system ended up in the ER or jail, which is pretty extraordinary and pretty far, a far distance from where we are right now. So obviously we have a lot of work to do to get there, but we're really excited about where we are and where we're going to go. Obviously there's going to be challenges, which the next slide kind of goes into. Number one, workforce. You can't talk about human services, period, without talking about the workforce shortages. That's real, and that's not something we have short-term solutions for. So we're going to have to figure that out. Well, although I always say if we wait till there's adequate workforce to do this, we're never going to do it, because that day may not come, so we'll have to figure it out. Sustainable funding. We are investing a lot of kind of one-time federal money in the system right now, but that money at the latest expires in 2026. So if we're really going to do this over a period of 5 to 10 years, we need the General Assembly and other folks to come to the table and help us with sustainable funding for this. The federal law that enabled 988 did allow for the imposition of a surcharge on cell phone bills, similar to the way the 911 system is funded, to fund this whole system. And so that's something that I know some folks are exploring, and I don't have an official position on it, so that's what I'm going to say about that. Obviously, there's a balance between the public safety issue and the therapeutic response. I think that everybody's waiting for that example where 988 was called and a team was sent out without without a law enforcement official, and something bad happened. We know that's going to happen, right? It's just that bad situations are no reason not to do the right thing. But we know we also owe it to the people we serve and the law enforcement and the community to make sure that we were able to strike that balance, and that's again going to be just a constant sort of evaluation and tweaking effort. This is not covered by most commercial insurance, just period. So that's a gap that we got to figure out. And then children sort of present special challenges here, which is another thing we need to figure out. The one tweak with children is that third pillar, the safe place for help, is replaced by what we call a system of support. So rather than taking the children somewhere, we need to do what we can to build up the systems around them. And then obviously the underpinning all of this, right? We can talk all we want about a shiny crisis system, but we know that things like housing and food insecurity and all the different social determinants of health and trauma and addressing all of those things really is what gets us to where we need to go. So even though we're excited about the system we're building, we acknowledge that perhaps it's built upon a foundation that needs work too. So that's what we're doing. Happy to answer any questions.
Thank you so much, Director. Great presentation. Thank you for coming from the state to talk to the city. I really appreciate that. It's usually the city going to the state, and we're humbled that you are here to talk to us. I've had the opportunity, Councilor Graves and I, we've been working with Director Rachel Johnson Yates, and she's been fabulous. So I have the opportunity for you to talk to you, and then I think we're going to have another meeting amongst ourselves. I have a couple questions before I turn it over to our colleagues.
Of course.
My colleagues. How can we work with the community organizations, faith-based organizations, and even the city and the council to help market 988, as well as not even market to even some sustainability as far as future beyond 2026? And you may not have an answer for that now, and you may have a partial answer for that.
Yeah. I got opinions, so I'll share those with you if you want. Great questions. As far as marketing or education, I would, things like this, right? Anytime, anywhere. That's kind of our motto with 98 in particular. You have a community meeting you want us at, we'll try to be there. And I extend that invitation to all of you, because we know that there's been a lot of interest around this in the community and a lot of misconceptions out there too. And frankly, misconceptions that are very understandable, right? Isn't this just the same old, isn't this a wolf in sheep's clothing? Isn't this the same old system with, all dressed up fancy with new titles? But isn't it the same thing? Aren't you going to get, aren't you going to get in trouble? Aren't you going to get arrested? All those are out there. We're seeing them on social media, and our only way to answer those is to come to the community and talk to them. And so I'll extend the invitation to all your colleagues. If you have constituent meetings you want us to come to, give us a little bit of notice, but we'll be there to talk about this. So that's the answer to number one. Number two, about sustainability. The main thing is, I know you guys are doing a lot of things in the city, and I think it's great. It's fantastic. Ultimately, the sustainability of this has to occur at the state level because we have that relationship with Medicaid. We have that relationship with the federal government. We have the ability to direct federal dollars to sustain the system, and obviously with that ability comes the need to impose certain requirements. So all I ask is, as you're building the systems you're building right now, that we talk and make sure that those alignments are, or those requirements are in alignment, because ultimately it would be a shame if the city of Indianapolis spent a lot of money on building a crisis system and that couldn't be sustained through the mechanisms that we're developing. So,
Awesome response. Colleagues, anybody questions? Councilor Booth.
Thank you, Madam Chair. First, I apologize for my dilatory arrival.
No problem. Go ahead and introduce yourself first.
Yes, Councilor Dan Boots, District 3, Washington, Lawrence Townships. Two quick questions. First one being, can you expand a little bit and tell us what the Tucson model is?
yeah, of course. So the Tucson model is the No Wrong Door Crisis Center, and they have a couple in Arizona, but the original one is in Tucson. And they've built this again over the period of about 20 years, so it didn't happen overnight. That's what their director is kind of famous in these circles, and she always says the first thing, to put people at ease, we built this over 20 years, didn't happen overnight. But they operate under sort of an extreme no wrong door philosophy, so they will take you in no matter what, if you're in crisis, figure it out, get you to the right place. They're intensely collaborative, not only with law enforcement, but with all the local behavioral health surroundings, and they have a relationship with the mental health court. It's just a very kind of seamless model that's been built over several years. They love to have people come out there. I'd suggest January-ish to go to Tucson if there's interest here. I'd be happy to arrange that if there was interest on the part of you or your colleagues.
Thanks. And quick follow-up with respect to funding. Are you concerned that with a $6 billion surplus, the state's going to have a problem funding this?
I am concerned about the sustainability of funding this. I don't make the decisions about where that surplus goes, obviously. We're investing a lot of money into this right now, into building it. But again, this needs to be built over a period of 5 to 10 years, and sometimes with a biennium budget process, that's difficult. I am concerned about the sustainability of it, so I'm not quite sure how that intersects with the surplus. It's kind of maybe, I don't know if above my pay grade is the right way to put it, but it's sort of outside of my lane at this point.
All right. Thank you for your answer.
Sure.
Councilor Jones.
Thank you. Thank you very much for your presentation, and thank you, Madam Chair, for allowing it to be here tonight on such an important topic. And I know in my district, I've seen the increase, especially through the pandemic, for the need for this, especially. Just a logistical question to help me understand more, because I know I've been put in this situation a couple times where I've had folks call me, and they have been in a very serious crisis, and they can't get into their mental health provider because we're so backlogged. And so they're like, can you help me? Can you help me figure out a way? And when I'm trying to get that referral for them, because they're in such crisis, the answer is they need to go to the emergency room because it's such a severe crisis. But that person is so scared to go to the emergency room because they're afraid that it will be out of their control and then they'll be admitted. In this situation, for this situation, would this be something that somebody like me, if they called me, could I call on their behalf feeling that they were in such a severe crisis, or would they have to be the person that could call?
Yeah, great question. Let me address the underlying theme here, elephant in the room, which is that our entire system is not where we need or want it to be, frankly. And so we are doing many other things, obviously, to get that system to where we want it, and we look forward to educating you on that further as well. I'm the chair of the Indiana Behavioral Health Commission, and we have a report coming out in October, which we hope will address all of these things. So the situation you've experienced is unfortunately all too common, and also is a major obstacle, a major challenge to actually 988 actually working, because if we build 988 on top of an inadequate system, where are we really going to be? So that's the first piece, which wasn't really a question, but I wanted to address it. The second thing is absolutely, I think we're working to build in the capacity to have members of the public be able to call on behalf of folks when they see a behavioral health crisis. That does get complicated. You know, one of the really tricky questions in this field, and there's no good answer to it, is that balance between involuntary treatment and involuntary treatment when sometimes a symptom of the disease is not understanding you need treatment. So no easy answers, but yes, I think we do anticipate members of the public being able to call on behalf of other folks.
Thank you very much.
Counselor Hart?
Yeah, just on the topic of individuals calling on other individuals, how do you prevent false positives in that case? And how do you prevent, just constitutional rights of freedom of another individual?
I don't think you can prevent it. Completely transparently, I mean, I can't think of a single safeguard that could actually prevent somebody from abusing a system that's in place. Like I said to Counselor Jones, I mean, the issue of involuntary treatment is the single most complicated, thorniest, nuanced issue that exists in this field, right? Our courts and our laws attempt to strike a balance, right? They attempt to strike a balance between somebody's constitutional right to bodily autonomy versus their, the need to protect them and the public if their disease means that they're a danger to themselves or others. That's not changing with this. I imagine that the situations might occur more frequently, but I don't have an answer to you about how to safeguard this. I mean, I don't think we can safeguard 911 right now. So, but it's a good question and something that I think we can talk about forever, and we should talk about, but there's not really a great answer.
Thank you. Counselor Graves?
Thanks, Madam Chair. Thanks, Director, for your presentation. Just curious to know if you have data or projections on how much of a relief this will provide to traditional law enforcement runs.
Yeah, I mean, there's been data from other places, right? There was one city studied this, and they found they were able to, and again, I don't know about the methodology, I'm just quoting the paper I read, but that they were able to save the equivalent of 37 FTEs in law enforcement by implementing a comprehensive crisis response system. Other figures have been thrown around, like 100, in Arizona, I think they were able to save, $100 million over several years. Every place that's implemented this and actually done it consistently over a period of several years raves about it. So I can tell you that much. And there is data out there on the money it saves. Again, I don't want to vouch for the methodology, but it will. I mean, the ER is an expensive place to go. Jail is an expensive place to house somebody. The more we can divert folks from those places, the more resources we can focus on other things.
Thank you.
Counselor Evans?
Thank you, Madam Chair, and thank you for coming with the presentation with this information. It's very much needed, especially at this time, and it would have been needed many years ago as well, but glad to see it finally coming out. I had a question about the 3 pillars and the quote about serving anyone, anytime, anywhere, and having to do with the workforce on the back as a part of the, one of the challenges, and also with regards to our city and other cities, how would you see that overcoming that? And, as we have seen in the past here, that being a challenge to getting services 24/7 in that capacity.
Yeah, don't have a great answer for you. I think there's some things that we're doing in this system that would lend itself towards, all over the long term, I think overcoming these. I think first, adequate funding, right? Ultimately, you pay good enough rates, you can generally fund programs like this. If you don't, you won't. So we're keeping that in mind, and also keeping in mind that when you're building a Medicaid rate, for example, for a 24/7 service, you have to build in additional funding for the night shift. That's part of the process. Using peers is something that we're really excited about because peers are one element of the workforce that have been around the state and locally have been more successful in actually filling those positions. So, we think that peer element is going to be one answer to that problem. And then the third thing is flexibility, right? So when we had the legislation around what the composition of a mobile crisis team has to be, we said peers and one of 4 other things, because you know, we want, because different places will look different. Indianapolis may be able to find a clinician to staff the daytime team. They may only be able to find an EMS technician to staff the nighttime, and we want that to be able to be billed down the road, right? So flexibility, peers, and hopefully adequate funding. But I mean, other than that, I mean, it's going to be a challenge.
Thank you. I have a follow-up question. Then we'll probably move to the next speaker unless any colleagues have anything else. In the other states that you've named and where we're trying to get to the same status of, does the state run their programs, or are they contracted out to other agencies or another?
Yeah, so the state, we're only running the call center, right? So we're going to run the call center. The mobile crisis and the crisis response will be sort of community-based providers. It's going to have to be a local state collaboration on those things. So the call center we'll take care of right now, because there I think economy of scale comes up. Like it's much easier to staff 5 call centers that can cover the whole state than it is to staff 20 call centers that cover a small corner of the state, right? But the other 2, I mean, are by definition local, right? A mobile crisis team needs to be close to the crisis, otherwise they're not going to be able to get there on time. And a crisis stabilization center has to be close to the crisis, or it's pointless to actually have it exist. So we envision the first part of that being, state effort, state responsibility, and we envision the second and third being joint state-local efforts. And I think that's only possible through collaboration.
And then again, Director, in the other states, is the state running their
same
system?
It's the same. The state runs, I mean, to the extent that there's call centers, the state runs them, but they're not state employees, or they're not state programs that actually staff these. The Tucson crisis model is an independently run agency that receives funding from Medicaid and support from the state, but it's an independently run agency.
Okay, thank you so much.
Sure.
Last call. Thank you for the opportunity. I'm going to come down and shake your hand for coming here today. Thank you.
All right, thank you. Thanks for having me.
Next on the agenda, we have our ARPA update, advocacy for non-fatal shooting victims, IMPD, Antonia Bailey and Deandra Dykes, victims assistance counselors, IMPD, and Dr. Lauren McGee, analyst, IMPD. Thank you for joining us tonight.
Thank you for having us.
Thank you for having us. Yeah, I can start there. Hi, I'm Laura McGee. I'm actually an assistant professor at IUPUI. I'm happy to be here today. I'm the lead researcher on the project and will be evaluating the program. I'm just going to start with some background of why this program was developed. Historically, gun violence programs have focused on homicides, largely due to a dearth of available data, as well as a lack of funding at the local and national level to study non-fatal firearm violence. However, the majority of gun violence that happens in the city is due to non-fatal firearm violence. The city has over 700 non-fatal victims a year. This has substantially increased since the start of the COVID-19 pandemic, and that equates to about 2.5 victims that survive a gunshot wound every day in the city. This is extremely concerning because non-fatal shooting survivors often suffer from physical disabilities, psychological and emotional trauma such as PTSD and depression, and unhealed trauma can lead to further involvement in violence and just continue that cycle of violence, leading to more shootings, more trauma for that individual survivor, the families, and then the larger community as a whole. Additionally, the majority of non-fatal shootings go unsolved. That is, there's not an offender who is arrested, or they don't know who committed the shooting, which is mostly due to uncooperative victims, that mistrust with the police, and the poor community police relationships. Furthermore, there's a lack of connection to services surrounding the social determinants of health of non-fatal shooting survivors within the police department, within the clinical system, as well as the community as a whole. So this program was designed to implement a trauma-informed approach for non-fatal shooting victims within the police department. And I'm now going to pass it over to Deandra and Antonia, who know most about the program.
Good afternoon, counselors. So we're just going to share with you a little bit about what our day-to-day is and why we feel this program is so important and so vital. Many of you know, and some of you don't, but me and Antonia both have been impacted by gun violence by way of our children. My son was injured 8 years ago at the age of 13, and when DeAndre was injured, traumatic brain injury, quadriplegic, completely changed our lives. There was no resources. There was no one to meet me at the hospital, which he was at Riley because he was 13. Anyone 15 and under is treated at Riley for gunshot wounds. There was no community resources available. No one reached out. I had to navigate this space on my own, and it's continued to be that way. And just over the years, talking and working with other community leaders, advocates, and the police department, we've discussed what it would look like to have a quick response to non-fatal or some kind of support. April 5th, I assumed the role as project manager, so I am creating this from the ground up. Super excited, but very nervous. But it's just been amazing. So we get commander sheets from the detectives every morning, and we review those non-fatal shootings. Was it self-inflicted? Multiple facets. We see a lot of self-inflicted. I would say we see about 2 to 3 self-inflicted a day. That's another conversation, but I would like to talk about that a little bit later. So we evaluate the shootings, and then I divide them between myself and Antonia. Now we're trying to process where we reach out per week. We have an outreach week, so because of the amount that we're seeing, it's kind of hard to do follow-up and immediate outreach. So now one of us does immediate outreach Monday through Friday, and then we do follow-ups. And what that looks like is we connect these families. A lot of times survivors are intubated, they can't talk, so we reach out to mom, dad, spouse, or whoever next to kin, check in on them first and foremost. What does it look like? Are they going to survive? How are they doing? Any follow-up needed with the detective. It's very imperative for families impacted by gun violence to know who the detective is. On my journey, that's been just a big part of our journey, is having that connection with our detective. So we make sure that they have phone number and email. If they do not talk to their detective, we're emailing the detective or walking over to the detective bay and saying, hey, this family is in need of a response or just a connection with you. And then we ask about resources. If they are shot and wounded and they're at Eskenazi, which a big portion of them are, we make sure that they connect to Prescription of Hope. Because a part of our program is to make sure that we also are creating community connections within ourselves and collaborations. Had a meeting today with the Indianapolis Public Safety Foundation to see how we can coordinate with their works through the GBI program and OPHS. So we're trying to work on a collaborative effort so we're not stepping on any toes and making sure that victims are getting everything they need, all services possible, but also making sure we're not duplicating services. So if someone comes to us and they were not outreached by Prescription of Hope, we can refer them to that program. We touch base 24 to 48 hours. If they're comfortable, we will continue a follow-up, 1 month, 3 months to 1 year. Some of our clients need a little bit more follow-up. We want to make sure that they are staying connected to the resources that we share. So we may call every 2 weeks, whatever their comfort level is and whatever we feel like the need is, and we stay with them. And it's been a great process, a great outreach, and we've been able to outreach 40% of the victims. We got that data from Dr. McGee today. 40% so far, and I started April 5th. We got out of training May 25th, so since May 25th, we've been able to touch 40% of the victims impacted by non-fatal shootings.
My name is, I'm sorry, this is my first. Thank you for having us today, counselors. My name is Antonia Bailey. Like Deandra mentioned, we both have been impacted by gun violence in 2019. Two of my children were killed while getting dressed for school in our Postburg apartments, which has guided me on this journey. A lot of people that we have been helping so far, some of them have been receptive, but not all. I have been able to connect at least 2 individuals with jobs so that that way they can sustain and be on their own. Have been able to connect with a lot of families and just be able to help them in general, meeting the needs that they didn't, with resources that they didn't know were available to them before. That's it. I'm sorry.
Questions?
Thank you. I want to start off by saying thank you both for the work that you do. Ms. Bailey's in my district. Hats off to you and your strength. I think, Deandra, we've worked together. You came and testified when I did my gun violence bill. So thank you for staying strong in the work that you do. I see you on Facebook with your son, and he's hanging in there strong. And thank you, Miss, because we got to have the data. Dr. Lauren, thank you, because that data is what I always, you don't never see me do a presentation or a testimony without data, because that backs up what we are saying to folks to legitimize. Not that we need a legitimization, we shouldn't, because when you see folks, that should be, people dying should be legitimization enough. But for some other folks, they need the data. Yeah. I remember when I did the testimony, I had folks coming up, and I wanted for my gun violence proposal, one of the counselors asked me, well, Counselor Jackson, why do you think gun violence needs to be a healthcare crisis? And I said, have you visited, when the last time you went to a cemetery? Or when's the last time you've been to a nursing home, or extended the part of the hospital where they're not in, where they're in long-term care at the hospital? People don't know about those wings. My brother was one of those wings, and he said, oh, I never thought about that. I said, it's a healthcare crisis. Yes. People are dying. They're being killed. Or the people that are behind and living, who you think paying the bills for them? And he thought about it, and he looked at me, and he said, I never thought about that. I said, that's why I'm doing this proposal. People are not thinking about that. And you're thinking it's not on your doorstep, sir. It's at your doorstep, sir. And he said, thank you. So thank you, guys. Counselors, Counselor Jones and Counselor Graves.
Thank you, Madam Chairwoman. I just wanted to thank you for your presentation tonight, and I just had a comment. I just wanted to thank you, as Chairwoman Jackson said, thank you for your strength and for coming here to educate us, again, about the data, but thank you for sharing your story, your very personal story about your family and your testimony, and that will impact residents. I know it's not easy to come here and share something so personal, but it will impact residents all across our city, and your story will have a legacy for the good. And we hope to be a part of that in anything that we can do. We're here for you, and I know Madam Chairwoman takes this very seriously, and we are here to support you. But I just want to thank you for your strength and your courage, and for your families allowing you to share your story. Thank you.
Thank you.
And can I just respond to that? And so when we're talking with these families, we're very open to what we've experienced with our children and how it has impacted our lives. And I believe that's a big part of why we've been able to outreach so many. So when we're on a phone with a mother who's sitting by a child who's intubated, I tell them my story. Since I've been in this position, my son has been on the ventilator twice as a result of ramifications from his gunshot wound, even 8 years later. And I find myself tearing up with the families, because when I say I know where you are, literally, because I've worked in this position by his bedside when he's on a ventilator, and I'm still calling families, and I understand. I'm not just saying it from a place of what I see on TV, but I'm actually walking that walk with you. And I believe that's a big part of why we've been able to outreach so many. And as a part of that outreach, we're trying to bridge the gap between community and our police department. We're embedded in the aggravated assault unit, so we're right there in the thick of things, and we're saying, you know what, we're extending this arm to show that we care. And so we hope, we have a 3-year grant. We really hope that it goes beyond the 3 years, but my goal is in this 3 years that we just make a world of difference of bridging that gap in trust between the community and IMPD.
Mm-hmm. Thanks, Madam Chair. And I just want to say thank you all. Dr. McGee, thank you, and Deandra, thank you so much for being so strong every time we talk, and we're on a couple of different committees together. So just really thank you for sharing your story. It really, as my fellow councilwoman said, it will continue to make a difference, a purpose for your pain. Thank you so much. And I think of Nick and National all the time. So I really appreciate you sharing your story and your time with us, Ms. Antonia. I want to ask you guys to keep in front of us what we can do to be a part of what you are trying to accomplish. My daughter is a therapist, and she, mentioned to me that the normalization of these after action issues is really what's bothering her most. things are just so normal. We had an unfortunate situation at 38th and Arlington just a couple weeks ago with the bouncy houses. You may have heard of that. And within a few hours, it just looked like life is normal. And I just want to protest. I want to do something to say, what can we do to not let this be a normal action and then, continue to move about your day. I want to stop the madness and get in front of the situation so we can bring attention to that situation and perhaps prevent the next situation. So please continue to be passionate leaders of what you're doing. Bring the concerns that we can address here before us. And, we're here. We have been blessed with our chairwoman, who is just absolutely passionate about these concerns and all things that are affecting the mental health of our people in our city. So thank you for what you're doing, and please continue to stay in front of us.
Thank you for that, Councilor Graves. Councilor Adamson?
Thank you, Madam Chair. Thank you for your presentation. It was very informative, and it seems to me like this is the kind of program that would really, especially of all the programs we see that kind of come through these chambers with the presentations, like one of the programs that's going to be the most impactful, because you're really hitting those sort of hidden players and characters in this drama that is going on behind the scenes that are sort of unseen but still very pivotal in this whole scenario that we're all intimately aware of and affected by. I especially like the components of the collaborations that you're building, and the personal touches, I think, are really going to be what makes the big difference in this. And to the extent of those personal relationships, while you were talking, I sent a message to my good friend Dane Nutty with the Public Safety Foundation, and he said that he just loves your organization, said you guys are doing amazing things. He's really looking forward to the collaborations that you guys are doing. My question is, you had said that the 700 non-fatal shootings, and then you had mentioned something about self-inflicted, and I was curious if that 700 included self-inflicted or if those were separated somehow.
The 700 are actually just assault-related non-fatal shootings.
Self-inflicted then.
Correct. So that would.
So the self-inflicted would be in addition to.
Addition to, which I'd say there's probably close to 1,000.
1,000 of the self-inflicted.
Self-inflicted. Because you said what, like 2 a day?
It's about 2 a day, and we've seen them gone up. They went up since July 1st, the self-inflicted, and I was actually over at Dane's office today meeting with Mary, and we talked about how we could collaborate on a gun safety class. So we know the law's here, constitutional carry is here, there's people fighting to repeal it, but while it's in place, what can we do now? My friend, her son went out and got a gun because of July 1st, and I said, he can't get a gun, he had an open case. And she said, well, that's not the way it's been displayed. People think they can just go and get guns, and he got arrested. And then I'm seeing all these shootings. So every time we see a foot or a thigh, we know someone has shot themselves. It's become part of our daily routine when we're evaluating these cases. So hoping to work with the Public Safety Foundation and OPHS on bringing a gun safety course. And actually that's something me and Councilor Graves talked about a couple of years ago, about bringing something in that space. So hoping to do that before the year's up, because it's needed like today.
Well, I appreciate your presentation, and I look forward to hearing more progress. And like Councilor Graves had said, do keep us in the loop on how we can play a role to help further what you guys are doing.
Absolutely, thank you.
Councilor Arnay?
Thank you very much, Madam Chair. I was just curious, and first off, I want to thank you very much for being here, and particularly for sharing some very personal testimony that I think just reiterates how important it is to do this work, and how wonderful it is that we have the two of you really doing such a fantastic job. I was curious, is this program something that other major cities across this country have? And if so, I was just wondering maybe a few examples.
Okay. So I've been able to go to some of the cities. Louisville, they have a very comprehensive program where they have victim services that actually touches non-fatal. St. Louis also has a very rigorous program, along with Chattanooga. It is not very common, so we're one of what, maybe 10 across the country that are doing this. Was able to go out to Charlotte, who is not doing it, and they want to come here and model after us and train after us to start something, a part of their victim services that actually touches non-fatal, because right now they only focus on homicide and traffic deaths. So we are part of something pretty uncommon across the country. A lot of pressure, but excited that people are actually listening and having a concern for non-fatal shootings.
Well, I don't think it's a surprise. Indianapolis leads the way on many things, and I think it's a fantastic thing that we're leading the way in this particular way. I think it might be nice to take a look at some other cities that are doing this and seeing how we stack up against them in terms of response rates, which I think 40%, just hearing that this evening, is a very strong percentage, but also their staffing. How many advocates do they have? Because that may be something for us to take a look at as we're building out this model, and as other major cities and comparable sized cities come to Indianapolis potentially to look to see how things are done. This could be just another example of letting our city shine, and I think in a very important and timely manner. A couple other things I was wondering, when we take a look at the average of 700 non-fatal shootings, as we just heard, those were assaults. Are those 700 separate folks or folks who may be involved in multiple non-fatal shootings included in those numbers as well?
If there's an individual who's involved in multiple shootings, they would be counted twice because each incident is typically counted as one incident. The injury recidivism rate is typically around 4% of people who are shot on multiple occasions.
So if an individual had perhaps been in a couple of non-fatal shooting incidents, they would be recorded twice in that?
Correct.
Okay.
Yes, that's just how the stats are collected as at a case incident level.
And lastly, I was just interested, I noticed on the program goals, and I think they're very, very strong goals, it talks about reinitiating community conversations. I was curious what those conversations are that we're reinitiating. What conversations has the city had prior to today, and maybe why were those conversations not continued, and what are we looking for as we move forward?
So pre-COVID, IMPD would host community conversations along with the coroner's office and the prosecutor's office and a couple of other agencies. One thing that we found, I attended most of them, is that the families impacted by gun violence were not showing up. It was, advocates, dignitaries, but not the actual families. So one of the things that I've been charged with is bringing those back, but actually from a community perspective. Getting out, sharing more about them, hoping to bring more community members in to get the education. And what that education is, what does it look like after your loved one is shot and taken or shot and wounded? What is that process? If someone's arrested, if there's what's the investigation process look like? Those are some of the things to educate. Because one thing that we hear most often is, I don't hear from my detective, I don't know what's going on. So we want to educate the community on why sometimes you don't hear from them right away. I know that because of my experience, but I didn't know it prior to February 1st, 2014. And so making sure that we're educating families and also those who have been injured on what the process is. So that's what the community conversations will be based about. And my hope with that is to work, again, with the other advocacy groups in the city as well to bring those conversations back.
I think that's fantastic, and just might make a final comment. I saw last week where the Public Safety Foundation, I'm very supportive of the Public Safety Foundation, is kickstarting its 12th Citizens Academy, where citizens can sign up over, I think, a 12-week period of time and interact with a variety of law enforcement agencies and departments and learn a great deal about them. I think it'd be fantastic if the IMPD and the Public Safety Foundation could maybe work just a little bit of time into their program, maybe just a half-hour presentation like this for your group, because I think that's important as residents learn about our police department, fire department, etc., that maybe they see something that maybe they wouldn't always hear about or know about. So kudos to you, and that might be something that I mentioned to Director Nutty moving forward. Thank you.
Thank you. And I'll just, you asked about the other advocates. So Louisville has 12 or 13. Charlotte actually had 2. And we're grant funded to have 3 for our team. Our third person couldn't start. And as the numbers were kind of fluctuating, we decided to wait. So in December, we will be onboarding a third person for our department.
Well, the two of you are doing a fantastic job.
Thank you.
Councilor Hart.
Thank you, Madam Chair, and thank you all ladies for all the work you're doing. And I just wanted to double down really quick on the gun safety course, just to reiterate comments from a local constituent that I had at a community meeting the other day. You know, like probably many of us, we go to a lot of these meetings, and it was just during open discussion. I actually had brought a speaker in, one of the district commanders for IMPD, was put that way, and we were, you know, trying to understand what the community can do to try and, you know, create a more safe city, and talk about some traffic concerns as well. But during that conversation, one of the recommendations that came from members of that particular community group recommended gun safety courses through IMPD, and that particular district commander was very, very, very happy to participate in something along those lines. So that long-winded answer to say, I would encourage working with IMPD to get some safety courses. I know you have my support, and my constituents are asking for it. So if there's anything I can do to help out, feel free to let me know.
Thank you.
Thank you. Any other counselors? All right. Before we conclude, one quick question. Are there any other cities you'd like to visit?
Yes. So Austin, Texas has a standalone division, 34 employees. It would be amazing to see what that looks like and how they actually operate. So they're connected to their police department, but they're actually a victim service division. With all the crime we have, all the violent crime we have in our city, it would be amazing for us to have a victim services division in this city. So I would say a long-term goal, but would love to see how they operate.
We can make that a short-term goal in the budget for 2023, Director Higgins, right? Thank you.
Thank you.
One more, thank you again, ladies. You are amazing. I've asked time and time again, if you need me, I'm here. You've had that extension from my other colleagues, and we have a council of 25, not just us. We're just community affairs. There are other colleagues that are here. Miss Bailey, I'm here. I don't know if you're still in my district or not, but I'm definitely here. Note that I'm here for you, and you have my private cell phone number at any time. I'm going to make a call out to you, your colleagues, and to mine's here. Every year I hold, let me back up now, I don't want to cry. 2015, I was in a mass shooting. I did not get shot, and I'm here live, but I had bullets grazing by my head. And all I can think about is my mom, and I was praying and said, don't let my mama have to identify me in the morgue with a bullet in my head. After that, I did survive. I had to go to physical therapy. I was injured very badly. I had to have surgery, and I had to go to physical therapy and occupational therapy for 18 months. The next year, I started my very first annual community peace walk, and I've been hosting it every year. This year is on Saturday, August 27th. Many of my colleagues have joined me from both sides of the aisle. Councilor Evans, you've been there. Councilor Arnay, you've been there. Councilor Graves, you've been there. I charge you because you say, what can we do? Councilor Graves will say, here, people. You believe it or not, when people see those, it's a sign of unity, and it does raise awareness when we do those. I challenge you to join me this year, not for show, but to raise awareness about gun violence. That's what it's about. You can go to pathwayindy.org to register. It takes less than 30 seconds. And join me at, we are going to do a press conference about it because that raises awareness. It's not for show. We're going to start at 10. We'll start gathering at 10, but as long as you're there by 10:30, and then we're going to join in unity, and then we'll start the walk right around 11 o'clock. Deandra, you have joined me a few years in your advocacy and Purpose for Pain. If you can join me this year on August 27th, I'd love to have you. Anyone, if you can join me. It's about raising awareness about the gun violence in our city. If no other thing on the agenda, I ask that we, and Council Booth, I think you've been there too. So I thank you all. Thank you again. Thank you for your personal stories. Thank you for your mission to help those and save others, because you're saving lives, believe it or not. Your work that you're doing and the mission you're on. We're going to get you out to Austin. It's going to be a pledge of mine, so that's why I asked that. And if you need us for anything else, we are here. Can I get a motion to adjourn? So moved.